today, so that way we can wrap things up and get everyone on their way. So our last one is part 2 of cultural sensitivity training. It focuses on housing as a healthcare, or housing is healthcare. Our presenters today are Sharon Rushing. She's with Health Net. She's a senior health equity specialist, and Holly Gill, health equity manager with Current Health Systems. Right.
Thank you for inviting us here today. I appreciate you all allowing us to present while you're eating. Please feel free to munch and engage. I am Sharon Rushing. I am, as Rick mentioned, a health equity specialist. Sometimes I like to leave the senior part off as I get older. Today I'm going to be talking about social determinants of health. How many of you are familiar with social determinants of health? The term or what it is? Okay, great. Good. What I do want you to know is as I go through and talk about social determinants of health, you guys are all working, you're already working with them. So what I'm hoping as I go through today's presentation that you will see everything that you already do and what I'm talking about and the terms that are applied to what you do. So before I get started though, I also wanted to introduce Holly Gill, who is with Current Health Systems. I don't know if you want to come up and introduce yourself. We are working together within this presentation. Did you want to?
Well, I think we're, yeah.
Okay, great. So can those of you in the back hear me? Thank you. If you can't, please just raise your hand. As I mentioned, I'm probably going to leave the mic here. I say because I'm Italian, I tend to talk with my hands, so I think the mic's going to go everywhere if I do that. But if you can't hear me, please do raise your hand. So I titled the presentation today, Housing is Healthcare. I think this is something that you probably all can recognize and acknowledge as well. And as we move through the presentation, we'll see the role that how housing or lack thereof impacts your health outcomes overall. So because today they will have a couple of discussion questions, I always like to set the tone by creating a safe and open environment. So the best way to be able to dispel myths and to learn is to make sure that our environment allows us to learn about someone else's experience, right? Open our mind to see something other than what we know. So a couple of things that I ask is that we respect each other's experiences and beliefs that are shared, the input they provide. Consider using the platinum rule, which is treating people the way that they would like to be treated. And then also practice flexible thinking. So when you hear ideas or beliefs that you feel are different from your own, that's okay. That difference is good. But that I ask that when you notice that you be aware of what forms your ideas and your beliefs. Because our ideas and beliefs are always formed by our own background, our upbringing, our experiences, right? So it provides us an opportunity to understand where others may be coming from. Be willing to share your ideas, but also listen to others, and then to empathize. All of us are in different places in not only our experiences in life, but also in the topics that we'll address today. Some may be more familiar to others may not. So put yourself in other people's shoes and just allow that space for others. And then finally, I always say that when you feel that discomfort, when we talk about certain concepts, if you feel a real discomfort within you or a tension, that's a really good indicator for an opportunity for you to learn. So if you walk away today and you step outside and go, I cannot believe what so-and-so said, really it's sort of an indication that you had an opportunity to learn something different, right? From your fellow participants here today. And well, hopefully you'll learn something from me as well. Okay, so our goal today is to explore and discuss social determinants of health and the relationship between one's housing and one's health in particular. So to do this, I want to sort of highlight how housing and health are inextricably linked. So you don't really have one without the other, right? And I'm sure, again, I'll probably say multiple times today that you guys are seeing this already in everything that you do, right? So I really want to look at how the state of one of those impacts the state of the other. So we'll start with a brief review of equity and inequality. So my understanding is in your last session, you had a presentation on equity and inequality and health disparities. And does that sound familiar? Okay, awesome. So I'll just do a quick review of that, and then we'll define and explore what social determinants of health are, followed by examining homelessness as a social determinant of health. And then we'll also look at that interrelationship that I just mentioned about homelessness and health, and how one's social position, economic position, and even political environmental ramifications really shape our health outcomes. And then we'll finish up with what I'm really calling sort of a review of engagement and communication with those that you serve, because it really is, it talks a bit about attentive listening, right, and active engagement. So it's more of a reminder. So in this first slide really is a depiction, and again, you all may be familiar with this. These numbers are based on HUD's 2022 annual homeless assessment report to Congress. And it really just shows you, see up in the corner here is change year, so it's for 2022. It gives you some of the numbers around the persons experiencing homelessness. And then on the bottom here, we see the sheltered and unsheltered diagram. And then some additional facts, some quick facts to present. These are from the 2023 State on Homelessness, as well as the National Healthcare for Homelessness Council. So what we see is that persons experiencing homelessness have higher rates of illness. I'm sure that's not news to you, but that they die on average of 12 years sooner than the general population, those who are housed. We also see that since 2017, there's been a total increase of 6% in persons experiencing homelessness. And in 2022, we reached a record high of individuals and chronically homeless individuals. So numbers, again, you may be familiar with. And then the last one I'd like to also bring attention to, because we're seeing that in our unsheltered rates are the highest among our racial, ethnic, and gendered populations. So in gender, we also see specifically our LGBTQIA+ and our TGI populations, transgender populations. So social determinants of health. So before we jump into those, as I mentioned, I want to give a little bit of background on this review of equality and inequity. And I always like to start with these foundational definitions, because we hear, especially now that health equity has really hit within the healthcare and public health arena, we see a lot of terms that get used interchangeably. And what happens when we have a lot of terms that get used interchangeably is that it can cause confusion. And with that confusion, that really takes away our focus of having more strategic strategies or more focused strategies to help the individuals that we serve. So a good rule of thumb, just before I give you these definitions, a good rule of thumb is to always, no matter what the source is that you're defining, so you're reading an article or someone else is giving you a presentation, is to identify how they're defining their terms, right? So you can be on the same page with them. So equality means that an individual or groups of people are given the same resources or opportunities, provided it's everything, something is provided as a resource across the board. It's the same for everyone. Equity, on the other hand, means that we recognize that people are at different circumstances, and so we allocate the resources and opportunities in an appropriate way for each individual to have their healthiest outcome. So we're really recognizing that we don't all start from the same place. So when we look at equality, equality works if everyone needs the same thing, right? In the US, we're really fond of the saying, pull yourself up by your bootstraps. And using that saying, this assumes that everybody has straps on their boots, right? Or that people are even starting with boots in the first place. So for me, this is one of those ways that we start to see the difference between using the term equality versus equity. Because when we look at equity, we really have to look at, if we give everyone the same thing, equity is not likely to occur, right? So even in this room, if we think about healthcare, across the board in this room, not even all of us need the same things to meet our needs, our health needs, right? So we in this room have very different health equity issues among us that would be perceived. Okay, so this is among one of my favorite graphics. Some of you may be familiar with this. What's one of my favorite graphics to show the difference between equality and equity? This is from the Robert Wood Johnson Foundation. In the top, you see this is the distribution of the same resource. So everybody is given a resource, the bike, and hence the opportunity to ride the bike. But as you can see, just giving everyone the same resource is not really going to allow people the opportunity to ride the bike, right? It's like, well, there you go, there's your bike. When we look at equity in the bottom half, this is where we see what it looks like in terms of allocating resources that really truly provide an opportunity to attain the healthiest outcome, to be able to ride the bike like everyone else can ride the bike. So it's really addressing resources where people are starting from is what equity is about. So an example also of understanding or conceptualizing the same difference between equality and equity was really made visible during COVID-19, which, by the way, in sort of a side note, for those of you who are noticing the terms health equity and social determinants of health more and more now, a lot of that was brought forward during COVID-19, because what happened during COVID-19 is that it was made visible that different populations were specifically those who had less control over resources, marginalized and minority populations were having worse health outcomes. So the point of bringing up COVID-19 with equality and equity is every single one of us in the US was impacted by the same health crisis. But we saw very different health outcomes, striking, stark outcomes that were literally forced to the front of our nation that we could not look past, right? So you'll see that's actually kind of what precipitated, even though health equity, health disparities, social determinants of health, for those of you who have may worked in public health, it has been around for decades within that, but is now just really coming to the forefront within managed healthcare and broader medicine overall. So health equity, and by the way, if you have questions, please raise your hand or interrupt me, or if I'm talking too fast, tell me to slow down. So health equity then is the state in which everyone has a fair and just opportunity to attain their highest level of health, right? Everyone has that just opportunity. And it really requires that we focus on overcoming some of the economic and social barriers, and especially some of the intentional and unintentional barriers from biases are systemic, things like racism and structures, right? So this is where we're seeing those injustices. So health equity really challenges us to understand that health differences are really the byproduct of the circumstances in which we are placed. It makes it harder for us to be able to control our health when we have little control over our own environment and our access to resources. And so with that, I want to ask you guys, so because I haven't given you a definition exactly of what social determinants of health are, what do you think social determinants of health are? And if you have an idea, write down 2 examples. I mean, I'll give you one sheet. The title of the presentation has one social determinant. One of the terms in it is a social determinant. It's what you're all doing, right? Housing. So you can think of 2 other examples within your environment or your community that have a direct impact on your ability to control your health. If you want to just write them down, or if you don't want to write them down, but if you want to share them with someone sitting next to you, I'll just give you like 30 seconds or so. share some of the examples? Go ahead. Transportation and disability, perfect, excellent. Others? Communication, education, community, geographical location. I'm sorry, I missed it.
I was wondering if genetics come into play.
Genetics. Well, genetics do, I'll touch on that a bit, but genetics don't necessarily fall into the social determinants of health. The social determinants are ones that we as a society create.
How about access to health?
Yeah, access to healthcare. Any others? Income? All right, awesome. So you guys are on top of it. You're on the right track. How about structural determinants of health? Housing. Sustainable housing, we'll put that one in with social determinants of health.
Like the lack of available appointments.
So that is also goes back into social determinants of health. That's okay. I don't expect you to know structural determinants of health because people are still trying to wrap their brains around it now, but we'll go through that one.
I think structural would be, I know back in San Diego County a few years back, certain or minority groups that would be steered towards certain neighborhoods, so that's still fall under social.
So that one actually falls more towards structural. So he said certain minority groups being pushed into certain areas. Correct, is what you said. Okay, yeah, so that falls more into the structural. So we'll actually go through that in this next slide. Thank you all for your participation. So social determinants of health can be considered those non-medical factors that influence your health outcomes or and create the conditions in which we live, work, and grow. So as you can see, your social determinants of health, those non-medical, which by the way, when someone just mentioned genetic aspects, when we look at social determinants of health, the key operative word really is social because we create them as a society, is that these are the non-medical, clinical, genetic factors. They create physical, mental health conditions. But they're really shaped by our wider set of national policies, our development agendas, our political agendas, our systems. So unfortunately, what also is created within there, our social determinants of health are also determined by our things like structural racism, institutional racism, which is what, I'm sorry, what was your name? Francisco, what Francisco kind of just pointed out, right? So in our structural determinants, and I have these, honestly, you would usually identify structural determinants first, but because in healthcare we work so much around social determinants, I wanted to give this definition first. What we see in all those things that you guys mentioned, the income, the communication, the transportation, access to food, full grocery stores, all of those things that you guys mentioned are really determined by those broader forces that we see within society that are really dictated, sadly, by our institutions, our political institutions, and by our social ideas around racism, right? So all of these are playing back into who has access to what resources. And when you determine who has certain resources, then you have limited their ability to manage your health, for positive or negative, right? Okay, so, and this goes back to the question about genetics, up to 80%, up to 80%, and honestly, in a lot of the studies and research that I've done, it's really closer to something like 85 to 90%, because we can see with genetic health and illness prognosis outcomes is usually around 12%. So up to 80% of all of our health issues are influenced by these non-medical factors. All of the ones that you guys just mentioned, right? That's the primary focus that's putting us into situations around our health. So it means that our health is driven by things outside of the doctor's office. outside of the exam room, but those things are landing us in the doctor's office, which is also why we're starting to see now physicians and the medical field and health plans and health institutions starting to embrace social needs assessments to try to understand what are the things happening outside of the biological aspect that we go to see the doctor for that is landing you with those symptoms in the doctor's office. So social determinants of health importantly recognize such factors as housing, right? And how they play in chronic health conditions like obesity, diabetes, blood pressure, stress, mental health, etc. And then the structural determinants really are those forces and systems, those economic policies that generate stratification and social class systems, which define what the individual's social position is in society. And that means when you define an individual's social position, you're also restricting their access to power and their access to resources. And then the last thing that I wanted to mention, I don't have it here, is social drivers of health. Has anybody been hearing the term social drivers of health? So social drivers of health is like a new term that we're really starting to hear, really like in probably this last 6 months to a year. And I'm hearing it very specifically within managed healthcare and those working in healthcare. As I mentioned, social determinants of health and health equity, these definitions are quite old. For those of you working in the public health, it's been around for decades. But now, because it is being more mainstream, there is a use of the term social drivers instead of determinants. One of those reasons, and this may be more information than you want to know, but one of the reasons that is because some schools of thought think that determinant means that you can't change them. The reality is determinant basically means factors. All social determinants of health are positive or negative. So the community you live in, those transportation, grocery store, access to health facilities, either you're going to have them, positive management to health, or you're not, negative management to health, right? So what we see with determinants, it just simply means a factor. But I myself had said, okay, I'll start to embrace it because I'm pretty old school, working in social determinants of health for far too long, and I will admit. But what I have seen is that starting to use the concept drivers instead of social determinants of health is helping people to understand, whether that's across institutions and health facilities or everyday people, is helping them to understand how those non-clinical factors in their community are impacting their health. So I kind of myself, I'm like, okay, I can get on board with that. And we have studies, a study in 2021 showed that only 46% of Americans were aware of how their actual environment in which they live, those non-clinical factors, really do influence their health outcome, right? So it is important that we are able to recognize that. You guys still with me?
Yeah.
You're not in post-lunch comas? Okay, great. So the next couple of slides, I have graphics that depict multiple social determinants of health. This one actually lists 14 social determinants of health. The reality is there are many more than 14. You will see in literature, some people will say the top 5 social determinants of health. There are many, many groupings. And if you start to break each of these out, you'll start seeing more social determinants of health within each. But I did want to provide a couple of the graphics show different ones. The really key concept in recognizing the multiple determinants of health is that they all are inextricably linked. A lot of times people want to say, well, what's the most important one that we need to address, right? And interestingly enough, depending on your focus of what you do, right, as you work, you might say, oh no, it's nutrition. Oh no, it's housing. Oh no, it's healthcare, right? The reality is they all work together. So you can't pull one apart. I'm sure if you think about the individuals that you serve, you can see that you're addressing the multitude of these issues, right? Every day as you're working with individuals. So it's really thinking about how they are all intertwined together and to be able to provide equitable opportunity for people to reach their healthiest outcomes. We need to address all of these. Right? This is why we're starting to really focus more on those non-medical aspects. So I do want to touch on really quickly, I want to take a moment to talk about SES. What does that acronym stand for? This one. Anybody? Social economic status. And what do we usually mean when we say SES? What's the word that we're trying to convey when we say SES? Income, right? So one of the important things that I like to point out about this is when we equate SES only to income, we lose a key focus of the social status, because it technically means social status, economic status. And when we pull that part out, we start to see that our social class is really important in our health outcomes. It's really important in those social determinants of health. Okay, so here's the definition. A social class is a group of people who have the similar relationship between power or lack thereof and allocation and access to resources. So what we see then is that one's class and the social class, that society, every one of us in this room has been placed into a specific class by our society, right? As soon as we popped out of the womb. And that our social class can be independent of income. So we see that, sorry, I didn't give you guys this stencil. So class, your social class is going to impact your ability to create influence, to make power, to have decision, power making and decisions, as well as enforcing change. So a couple of examples of this, because we're so tied to thinking about SES and income as if I were to just throw money at the situation, then all of those social determinants would go away, like everything would change. But that's not the case, because we have classified people socially, and that hence we have limited their power and access to resources. So for example, we could take things like one's age, one's just gender, race, ethnicity. So let's start with by age. In the US, you have to be how old to vote? 18, right? So in this one fairly mundane example, you could be an 18-year-old who has an abundance of resources and power and allocation and access to as much resources and money that they need. But until they can vote, they don't have the power of influence or to affect change, right? Then more importantly and more seriously, if we think, by the way, voting is very important. If we think about social class separate from income by race, ethnicity, and even gender, we know that there are people, race, ethnic groups, people of color, who have an abundance of money. Yet, they still may be restricted in their ability to influence, have power, and make change, right? So for me, I always drive this home that it's really important that we don't hide or obscure the social classes that we create, because built into that is our individual ability and power to change. And importantly, that power dictates your ability to control the expenditure of your energy to acquire resources. So I think you see that not only for yourself, but then also for the individuals that you serve. And then lastly, so as I said, as a society, we get socially stratified, and as we get socially stratified by class, this determines the amount of power we have. And that power, or access to resources, is known as our human capital. And our human capital is our means of coping. It's your ability to buffer exposure to health risks and health outcomes. Okay, I don't want to lose you. I know that was a lot of lecture-y terms, right? Hopefully I haven't lost y'all. You guys still with me? Yes, thank you. Okay, but it is really important, I think, for us to understand when we're talking about social determinants of health, because it goes hand in hand with, yes, money will help us go a long way, but a lot of the issues that we're facing need to address the fundamental aspects of equity across the board. Here's another graphic. a very colorful one, so hopefully this one got you guys got your attention. Oh, wait a minute, okay. I'm missing that one on my, oh, here it is. So, in this one, since we talk about social status and the ability to control the resources, we can see that demonstrated in the social determinants of health. So this is another grouping, and this sort of breaks some of them out, right? So we see in the top one, physical and built environment, homelessness and housing instability, living in an unsafe and or unhealthy living environment. And as we were to walk through all of these, I am sure that you guys can actually see how each of these, we have for social support. I think somebody mentioned earlier community up front when we talked about social determinants of health. I think it's one of the most underrated determinants, social determinants, in being addressed in terms of health and also in housing and access to resources, because that sense of community is critical for people's health and mental health overall. Okay, so as we know now, persons without homes are now more than ever severely limited by social determinants of health. So that's leading to more chronic health conditions, mental health issues, substance abuse issues, and risky behaviors. Here's another example of social determinants of health. So I'm just kind of like flooding you guys with different examples of what social determinants are. But this helps to actually give the lived experience of what does it mean when you don't have food? What does it mean when you don't have housing? What does it mean when you don't have access to basic healthcare services? What does that look like, right? And how, I think a couple of you mentioned access to healthcare. Another really important one is quality of care. Someone also mentioned communication. If you can't communicate with your provider, if there's not interpreters, if you don't have same language providers, then you're going to hit a wall on healthcare services around as a social determinant of health. Okay, and I think this is my second to the last graphic for you on social determinants of health. But one of the reasons that I really like this one is this shows a model of how all of those things of equity work together with social determinants of health. Sometimes, so on the far side here where it says socioeconomic and political context, sometimes those are referred to as upstream determinants of health. And then this side here closest to me is referred to as a downstream determinant of health. And what that means is that all of these factors on this upstream side, you can see are those ones that we defined as structural, right? The things that we said, what's our governance look like? What do our economic policies look like? Our social policies like labor market, housing, land zoning. The extent to which we have equity, the degree to which we near equity in these systemic policies, we will start to see better outcomes as we move downstream. Right? And these intermediary ones, this is kind of where we are within healthcare. We're working in these places as the outcome, the byproduct of the impact of certain policies, as Francisco said, individuals being forced into certain areas to live is really going to impact what kind of education is available in that area. Can you work in that area? If you have to work somewhere else, do you have a way to get there? Is there any transportation? Right? That's going to severely limit your income. So we start to see how those play out. Really critical in the middle here, social cohesion and social capital. Those go back to things that we talked about for the human capital, your ability to influence and change and cope with the environment that you have been put into. Okay, and so then we see the downstream ones on this side. Okay, so a couple of things in addressing social determinants of health. These goals are very like broad level strategies in understanding that there may be many other needs that will take priority over health. So as a healthcare representative, that's probably not something that I'm supposed to say, but the reality is when we're looking at social determinants of health, there are so many other needs that need to be met that are impacting health or before you can even get to health, right? Some other strategies include collecting social determinant of health data on unhoused and importantly, the risk of homelessness, Because once we start, like we're seeing right now, because social determinants of health are just starting to be embraced, and how many have you done assessments for social needs? Anyone? Social needs assessments? Okay, so they're coming down the pike more. We're actually seeing them in healthcare legislation. So what we're seeing is the better data that we can collect around that in terms of unhoused and the risk for homelessness, the better we'll be able to focus those strategies. And then the last two are ensuring proposed and existing policies and practices really do impact health change. I think, I know this is sort of cliche and I'm preaching to the choir, but we are the ones that have to hold legislators accountable to the policies that they put out there. And also ensuring that interventions and preventions are multidisciplinary. So again, it's not just focusing on one of the social determinants of health, but looking at the big picture of how all of those things are impacting together, right? So we look at this one and say, well, if I live way out where I have no access to transportation and no employment, then we need to address all of those things together. And then this one is the last graph, actually. So this one actually talks about moving past the midstream, which is where we are, and it's a great start because for many decades we've been down in the downstream, just dealing with the symptoms, right, in a medical way. So moving up, and the good news is to see that moving toward the upstream part is really looking at those the impacts within the community and the broader change in building a healthy community. So this is an activity, but I'm not going to have you do it right now. I'm going to ask you to do it when you leave here today, but I'm going to walk through the instructions on it now, and then I'll remind you guys at the end. This activity is really to help you reflect on all of the social determinant of health information that we just went through, and also for you to apply it or personalize it for yourself and understanding. I think what I see in working with social determinants of health is that those of us in health think about them affecting everybody else, and we forget that we're all subject to those same social determinants of health in our own healthcare, right? So I like to also personalize it. So what I'm going to ask is that when you leave here today, whether you're driving, walking, however it is that you're getting home, that you really do what I call a windshield survey. Just look out the window and pay attention to the community built environment. So are there safe streets? Are there grocery stores? Notice the kind of businesses. How has it been zoned? Are there buses, street lights? What do the advertisements say? I think we forget sometimes to look up and see what's being advertised in the communities we live in. Are there health facilities? Are there pharmacies? So just really pay attention, and depending on where you live, you're likely to go through multiple communities. So start paying attention to those transitions you see from one community to the next community, and see how, if you had a chronic illness, how would you manage that illness within each of those communities based on access to resources? Even things as simple as when a doctor tells you to, well, you really need to eat better and exercise. It's like, number one, do I have a full grocery store? Is it affordable? And then two, we're looking at, do I have a safe place to exercise, right? And we're talking about individuals who are housed in that example, right? So looking at that broader one. And then really, when you get home, think about your own community and look at both the negative and the positive assets in your community and how they help you manage health. How are we for time? I know we were over, so I am trying to get closer to the time you're supposed to be. Okay, we're talking about contextualizing health and homelessness. What this means is really just kind of trying to understand the context, a bigger picture of what places someone in their situation. So and again, this is stuff in these next couple slides, you guys are probably very familiar with a lot of this. So 4 ways in which housing can impact or undermine one's health is substandard housing, housing instability, housing affordability, and one's neighborhood. So when we look at housing, substandard housing, we're looking at hazards that can impact your health in the home. Things like exposure to lead, pest infestations, poor ventilation, water leaks, which can cause mold, exacerbating asthma, right? All of these things, just based on the type of housing, are going to critically impact your health. When we look at housing instability, what we see is not having that consistent security creates mental and physical stress, which leads to health outcomes. This is going to be a side note, so I'll try to say it fast. There was a study done in, I believe, like 2004, where an individual worked with adults who had been raised in they had a secure home. So their family owned a home for much of their upbringing. So he took individuals whose families owned a home and those who had never, their family didn't own a home or had secure housing. He injected, via their nostrils, injected the flu virus. And he found, and by the way, this is much later, these are all adults. So even if they now had a secure home, he found that those individuals who were not raised in a secure housing environment were more susceptible to the cold virus. So the long-term exposure to your immune system and just over that time, insecurity. So we're looking at that housing stability. And then housing affordability, what we see a lot here, as I'm sure you're well aware, is the competition for costs for basic needs and utilities and essential expenses. We also will see as well for housing affordability is sometimes there will be crowding if there's multiple families, not just multi-generational, but multi-generational and multi-family. And then your neighborhood, I think we've kind of talked about this one quite a bit, right? It includes those things like the open space, grocery stores, exposure to pollutions, as well as violence and crime. And then in this slide is, I really just put some of these together to give an example of, again, that interlocking impact that health and housing have. And this kind of allows you to disarticulate it or pull apart how they compound one another. Because if anywhere you start, you will kind of end up in one situation creating the other. So if you're having a poor healing and recovery without housing, you're going to have an increase. You're less likely to have access to care, which means you're going to have higher chronic rates and acute rates, which means bills, etc., could land you in experiencing homelessness. So this really kind of, no matter where you start, if you're currently without housing, you're likely to end up with new physical and behavioral health issues, right? You guys with me? I'm going to keep waking you up. That's all right. Okay, so it is estimated that 85% of people experiencing homelessness experience at least one chronic illness. And I imagine that these are some of the ones that you guys may encounter yourself. So I have them just grouped by broader categories, but you can see some of the examples within those: infectious diseases, musculoskeletal problems, psychiatric illness, substance abuse related illness, chronic diseases, and diseases of neglect, things like nutritional issues and dental issues. So in the next one, so what we didn't see included in the last slide was the impact that homelessness has on mental health and the stress. And it's interesting because when I selected this slide, I thought, oh my goodness, this slide is so chaotic. And then I thought, well, that's really a great representation of what I'm trying to convey, is that you have so many things coming at you, some of these that we've already talked about, that it leads to this compounded, continuous chronic stress. And that chronic stress leads to more chronic diseases, not just mentally, but also physically. Okay, so this last section, this is really sort of a reminder, a review around engagement and communication with the individuals you serve. But basically, I was focusing on it in relation to being able to have them share with you or elicit what social determinants of health that they're facing, right? Of course, you have to say, what are your social determinants of health that you're facing, right? But in the work that you do, you're probably hearing, like, I don't have a way to get there. I don't have a regular doctor. I don't have health coverage. I don't have anywhere to get good food, right? So those are their social determinants of health. but being able to have them open up and talk about it. So this is really, really focusing on some of those approaches. But I wanted to start with the idea of viewing homelessness through a health equity lens. So what you see here, and as I discuss this, I was going to have this as an activity, but I think I decided to have you guys just think about it because it's really asking us to reflect on our core beliefs around persons experiencing homelessness. So really conventional views are that you're homeless because it's a personal responsibility. You made poor choices that put you in that situation. Another view is that your situation is unfortunate, but it's not just. That's life, and life is not fair. And then the third one is, well, nothing can be done about it. Since there's so much structural inequalities in our society, nothing short of a revolution is going to be able to change it, right? So really, I'm asking, like, we have to think about how do we normally, conventionally think about individuals and their health outcomes and why they're experiencing homelessness. But when we really start to focus in on the social determinants of health, this really moves us toward looking at it from a different perspective. It shifts us to look at and understand that it's not so much that homelessness is really just a personal responsibility, but that we have to understand what are those social and economic situations that have put them where they are. I'm not saying that we can absolve everybody of their own behavioral choices, but we cannot wipe away with that the conditions that we've created. So what are our social and political responsibilities to not just the individuals we serve, but to our own community, right? That tells us what are we doing? That's where I say we gotta make sure that the legislation that we see is really making and affecting those changes. What are those barriers? So the same for, it's unfortunate, but it's not unfair, really turns us to look at, well, there's a lot of different causes. So what are some of those causes? Gender exploitation, class, racism, prejudice, discrimination, all of those can make what we like to say, well, it's unfortunate, but it's not unfair. But we see people are being put in those categories. And then for our last one, nothing can be done. Again, this is talking about not acknowledging and pushing for policies that really undo these social situations that we've created. You know, the good news and the bad news about social determinants of health and the health outcomes we see is that we created them. That's the bad news. The good news is because we created them, we can uncreate them, right? It just takes a lot of work. So this slide here, you may be familiar with these as well. These provide some models for approaching and increasing the awareness and understanding within eliciting some of the social determinants of health. First one, cultural competency. How many familiar with cultural competency? Yeah, I'm sure you've probably heard that one. Within cultural competency, there's really more of a focus on the other, right? So understanding the other person's culture or the other person's needs. And really when cultural competency has been around since like it grew out of diversity in the 1970s. But what it really did was kind of end up pigeonholing people by saying, oh, this is their race, ethnic background. And that's what we have to focus on. That's so limiting in nature because as we saw, our social determinants of health are much broader. So some of you may be familiar or hearing more around cultural humility. Yes, no, maybe? Yeah. So cultural humility really is a commitment to developing a mutually beneficial and non-paternalistic clinical and advocacy partnership. There's three primary tenets of cultural humility. The first is to shift that focus away from the other by saying, well, this is this person's issues, but also it asks you to critically do self-reflection. And by critical self-reflection, that means, are you asking or placing your expectations on other people? Right? And then the next one is cultural humility includes attention and acknowledgement of power imbalances. Even for those of you who are serving your communities, you are at a differential power level than those that you serve, right? By the nature of what you're doing. So it's acknowledging that helps us to better communicate and be present with the individuals. And then the last is, again, I will hit on is holding institutions accountable for addressing those health equities. And then structural determinants of the structural competency refers to responding to people's needs in that very integrated way that looks at their entire situation, acknowledging those social determinants of health. So a person or talking to individuals about their experiences of social determinants of health really requires the care of humility, because we have to pull back and not place our expectations and beliefs and ideas on them. And I imagine, that's why I say this is review, I'm guessing, for you all, because I'm sure that you guys have, you're doing this and communicating and interacting on a daily basis. But I also think too, part of why I want to include this is that, have you heard of compassion fatigue? Familiar with, okay, now I hear you guys, all right, I hit a nerve. Okay, no, but the good thing is that in part of why I wanted to bring these up as review, because you do this regularly, is because it's a reminder, because it's very easy to go into suffer from the compassion fatigue, from dealing with the experiences of those you serve and the trauma that you see can weigh heavily on you. I mean, I myself would guess that you're all very empathic people because of the nature of the work that you do. And that in itself makes you open to the trauma and experiences of those that you serve, which makes you good at what you do, right? And so it's really, again, creating a space of trust to allow individuals to share everything from their physical to their mental to those social and behavioral situations that are impacting where they are. So one of the ways that this can be done is through engagement that is uses empathic inquiry, which means that it's communicative a way to connect, to generate compassion, and also confidence within the individual that you're sharing or serving. So it allows the individual to be heard, validated, and respected. And then a second would be the person-centered approach. In the person-centered approach, what I really want to drive home is person-centered means that what you choose to do is guided by that individual's goals and values. Not yours, not what you think should be done, but by their goals and values. And then opening that space to be able to hear what those are. And then again, integration. Person-centered means you're looking at all of their compounding issues that have them in that situation, and a partner commitment to that person's well-being. And then the last one is the attentive listening. So attentive listening asks us to be aware of our engagement. So being attentive in the words that you use, your body language. And by the way, I want to point out body language, I think, is one of those things that is, again, really rated or under noticed in any conversation. In fact, everything I'm saying to you, all of the words coming out of my mouth account for 7% of your understanding of how you're receiving the message. 38% of that is my tone, right? So I've been told repeatedly that I can be very intense with my tone, especially in particular when I'm talking about health equity and social determinants of health. It's my passion, so I'm probably intense about it, right? That's my tone, it comes across. I could be out here going, and then we also have be aware of your body language, right? My tone is completely different. My words were exactly the same, right? And then the last is 55% of all communication of what you're understanding or putting out is your body language. Again, I could be up here like this, right? Which may convey something very different. Or again, just like, yeah. So I'm conveying what kind of interest do I really have in the conversation I'm having with you? And then to be aware of your biases and your implicit bias. Implicit bias means, by the way, every one of us in here has biases and preferences. So implicit bias means you haven't brought those to consciousness. Explicit is it's very clear that you have a bias and everyone's aware of it. So paying attention to what your biases may be, and then asking open-ended questions, those probing questions, but asking in a really respectful way. And then paraphrasing by demonstrating that you're listening also helps to build that trust. And then summarize by checking back your understanding of what has been shared with you. Ultimately, it's asking you to be present, which again, when we talk about compassion fatigue and what you do, it makes it extremely difficult to be present when you have that compassion fatigue. So last ones, and you guys may have some fatigue right now, right? I'm guessing it's compassion fatigue for me being up here and droning on at you. Again, it's just meeting others where they are. Specifically for those who are unhoused or experiencing homelessness, understanding what's their comfort in being in and coming in to talk to you if you're in a facility. What are their perceived ideas? And then what are their real barriers? Their perceived barriers and the real barriers that they're facing. Okay, so I promise you we really are at the end. Okay, so I want to close with this exercise about building compassion resilience. Okay, and this one, I want to ask you to just hold, and you can, again, practice this in what you do on a daily basis, but right now, I want you to think about a person that really presents a challenge to you, whether it be in your daily life or in your work life. And it could be me right now, that's fine. Okay, but I want you to think about hold in your mind, literally, figuratively, someone that may present a challenge to you. And then I want you to tell yourself, just like me, this person is seeking happiness in their life. Just like me, this person is trying to avoid suffering in your life, in their life. Just like me, this person has known sadness, loneliness, and despair. Just like me, this person is seeking to fill his or her needs. And just like me, this person is learning about life. All human beings need attention, affection, recognition, and happiness. And I want to close with one just really, really quick story. One of my first, I have worked within healthcare internationally. And at this time, I was actually in Kenya. And while I had worked with street kids who had been either sold into main cities or had come because they were starving, I remember meeting with a woman who in Kenya, in Nairobi, who was actually putting on like she did theater for street kids. So she gave them a space to come and express themselves. And so I was walking down the street, talking with her, and kids were coming up to her. And I remember her saying to me, as kids were like jumping on us, and we were, holding kids and, walking on they were on our feet and walking with us. She said, the thing that I've noticed the most with kids that have no homes is they just want to be touched. People don't touch them. And this last sentence here, sorry. We all need affection. It's really easy for us to look at those who are in these hard circumstances and want to back away. But they need to be touched. And I know you guys know this, so I know I'm preaching to the choir, and I apologize for the tears. This does not generally happen. Okay, so that's it today. I will open for questions, and I will just remind you with this last slide to please consider your environment when you're driving home today, and think about how each one you're driving through impacts your ability to help others. Apologies for the tears, y'all. I'm so sorry.
Okay, so just 1 second before everybody leaves. One of the things that we really want to do is make sure that the training that we're providing you is helpful and it's what you need. And so for the next session, we are soliciting feedback on topics that you would like covered, things that you would really help you in your day-to-day. So I know everybody wants to get out of here really quick. If anyone wants to kind of throw out some ideas of some content that we can develop for the next session, or you can always feel free to share your feedback with Rick, and then he can forward it on to us. So really quick, just putting it out there. Are there topics that are of particular interest for you guys for our next university.
Coaching with difficult clients.
Coaching with difficult clients, excellent,
Resources offered by Health Net.
wonderful. We were more than happy to do that. So that was a request for resources from Health Net or Current Health Systems. Yes.
I'm sorry?
What was mental health? Okay, so I'm gonna put mental health resources. Anything I could get?
Probably more counseling services. That comes a lot in the, as far as like somebody who becomes sick. And it has a lot to do with the mental health. If we could get more therapy and counseling. It would even be good to, she brought up, compassion fatigue, or am I saying it backwards?
Yeah, well, that was one of the topics that we were thinking about really expanding upon because in the line of work that you are in.
I was gonna add that, is compassion fatigue is something that we should really, focus deeper on, because it's big right now.
Absolutely.
How about a class on how to teach your clients to get ready to apply for jobs, or not jobs, but housing, dress, how to manage their children when they're there, just get them ready, cover letters, anything extra that they might need to get all prepared.
Okay, no, wonderful. These are all great ideas. Anybody else? And again, you can always email Rick and he will share that feedback with us. What we can do is probably for next time, focus on a couple of these and then also bring in resources, and that can be stuff for future sessions as well. But thank you so much, Sharon. You did a fantastic job. I appreciate you.
All right, everyone, next session is gonna be August 24th. We're gonna cover, the next part of, what, Harper was talking about, and then we will also have, another presentation. If y'all need to, there's extra waters. You guys stay safe in this heat, and we appreciate you all. Thank you so much.
Okay.